Okay, thank you so much. Well, this is my topic. I start. This is my conflict of interest. Facts. All of us know that dark skin types, 3, 4, 5, and 6, have a higher risk of PIH after any kind of laser treatment. I will show you the way I handle with that. I can get improvement in this kind of skin colors. Another fact, I live and work in Argentina. Majority of our population has skin type 3 and 4. I am skin type 4. Close to nothing of 1 and 6, and really few of type 2 and 5. And this is our typical idols, sport stars that are going around the world with our fans. And well, one of them win the Finalissima a few days ago. My great clue is the first appointment. When you have a patient with dark skin, FIPATRI 3, 4, or 5, looking for improvement in the quality of the skin, you need to explain carefully what is PIH, and which we need to handle with that, of course, in the post-treatment recovery time. And of course, explain before and after laser treatment. I want to show you some clue. And evaluate the expectation of the patient, if ideals or no. And both of us decide which laser and which treatment to choose. I divide my patient into three different groups. My ideal group is the first one. Patient with the lowest patience to wait for results, but the highest patience to handle for a longer PIH and longer post-treatment recovery time. I choose CI2. Patient with the lowest patience to handle a longer PIH, but the highest patience to wait for results and gentle post-treatment recovery time. Well, I choose LAOB, laser-induced optical breakdown, or a combination or IPL plus 5-LA. And the last group, my initial group, patient with the highest patience to wait for results, but no tolerance at all for handling with PIH or gentle post-treatment recovery time. Well, I choose Hollywood pill. I show you example of the three groups. These phrases are in contact battle inside my mind when I have the patient in front of me. Better and fast results, worse post-treatment recovery time, for sure. Unless and so result, gentle post-treatment recovery time. Well, I say you, it's a decision of both of us, the patient and the practitioners. These are my tools. These are my juguetes, my tools. I use iPixel CO2, Pico Plus, Picosecond, Nanolight, IPL, Fox, Diodo laser, NDMED, radio frequency. I only talk about the three first of them, sorry. My first group, patient with lowest patience to wait for result, but the highest patience to handle and a longer PIH and longer post-treatment recovery time. Patients who look for results. Well, I offer that, the iron effect. For sure, if I have a CO2, I can erase wrinkles, I can erase some kind of sequel, scar sequel, and some kind of lesion of the skin. But we need to handle with that, with a longer PIH. For example, in this case, I ironate the face. The patient have any kind of wrinkle, but we need to handle with that several months, no less than 3 to 6 months. Or I said a prolonged post-treatment recovery time. Well, this is one of my best cases. The patient was, I performed a surgery, facelift, many years ago. She requested me a new one. I said, no, you need only laser. And this is a difficult FIPATRI 5. 2 sessions, I was able to erase all the wrinkles, but look at in a close view. And again, I take out the color of the photo to give you the possibility to measure better results. I was able to reduce the fold and a skin tightening of the upper eyelids only with the CO2. But you need to handle that, a complete week in this way. Here I am, perform the treatment. I put some spots of heat in each session, in each pass. Another difficult skin, FIPATRI 4, and you can count the wrinkles around the preorbital area and around the mouth. And if you can count in the right, you can reach until 10, and on the left, maybe 30. The other side of the other profile of the same patient, the results. FIPATRI 3, but when intensive photo damage, a close view, to show you the way I can erase not only the pigmented lesion and at the same time reduce the wrinkles. A patient that in which I combine not only CO2 filler 2 on the lips, but you can see the ironed effect in the malar area. Difficult patient, FIP-4 with a lot of acne sequelae scar, and look the result after 2 sessions. And then again, a close view, a profile to see the iron effect again and again. Another difficult, male, FIP-4, sequelae of the temporal area and malar area. Look that. Again, if you try to count the lesions, of course, you can see the decrease of them. Difficult patient, FIP-5, again, look that. The way I can remove some of these acne sequelae. I love to play with my tools. If you use the surgical handpiece in focus, you can cut, but if you unfocus, you can give you ablation or some lesion. As you can see here, you can do it with a scalp, you can do it with cryotherapy, but I do it with laser surgery, and the patient pay me more for that. And I was able to remove warts, xanthelasmas, another xanthelasma, and FIP-4, and syringomas. My second group, patient with the lowest patient to handle a longer PIH, but the higher patient to wait for result. Well, I choose LAOB, laser-induced optic up and down, or IPL. What is cold rejuvenation LAOB? We use a picosecond laser. We focus the dots. That's why the photoacoustic reaction appear inside the dermis. We create vacuolas. Our body noticed that was injury. That's why try to fill it up with collagen cell. That was making thicker the skin. That's why we get improved in the quality of the skin. And here I am during the procedure in an acne sequelae in the temporal area. We leave only redness on the skin for 3-4 days, no more than that. No scalps, no any kind of other lesion. And here is the patient in the profile, FIP-3, in a close view. Again, another close view. And if you can compare, I was able to reduce the acne sequelae scar. The same patient, the other profile, and my result. This is FIP-4, difficult patient, and he only want to get improved in the quality of skin. That's why I can get glowing, reduce the size of pores, and at the same time reduce some pigmental lesions. When I add 5-aminolevulinic acid to any kind of light length or laser, in this case IPL, I produce the photodynamic therapy. I use this aminolevulinic acid to increase cellular light affinity to obtain that. Again, try to count. I think there is 20 wrinkles around the periorbital area, only 4, and important, after 6 months, she still have only 4. And again, difficult color, FIP-4, and in patient around the 40s. And my third group, patient with no tolerance with PIH, no tolerance with any kind of post-treatment time. She wants to return to the office at the same day. They call that the laser branch, and I can offer that. And the patient have a lot of inform of that, data from media, and they request me this treatment. And here I am. We apply a carbon solution, wait 15 minutes to allow this carbon solution go inside the pores, and then we apply this laser and remove not only the surface, at the same time create the photoacoustic reaction inside the pores. This is the patient before, during the treatment, and after the treatment. I give you a close view to see the reduce the size of the pores. Another patient, FIP-3, you can see here the reduction of the pigmental lesion, and again, glowing and reduce of the size of the pores. Sometimes I combine this treatment because all of them are really gentle. Hollywood peel first and cold rejuvenation next, and only keep, I said you, 3-4 days of wetness on the skin, no scalp, no blisters, nothing of that. And this is my result in the complete change in the quality of the skin of these patients. And my another great clue, before and after skin topic treatment. And sometimes I apply Q-switch laser because I have it. My ideal treatment, 1 month before the treatment, I prepare the skin. And 3 to 6 months after treatment, I continue with the treatment. My own recipe formula, homemade, formula A, plasmin and melanocytic inhibitor formula with tranexamic acid, kojic acid, glycolic acid, and hydrocortisone. Formula B, melanocytic inhibitor formula, hydroquinone, kojic acid, glycolic acid, and hydrocortisone. And sometimes I apply twice every 15 days pico laser because I have it. In conclusion, dark skin has a higher risk of PIH, we know that, but even that, you can obtain extraordinary results with different kinds of laser treatment. It is crucial for me have a Q-switch laser treatment in case of longer PIH because it helps you, and always combine before and after hypopigmented formulas. Thank you so much for your attention.
Thank you, Dr. Paris, for your great presentation. Thank you so much. If there's some questions from the audience.
Cesar.
Beautiful presentation. Sometimes I use the Hollywood building more than my patient ask me about this, and they want to do, but actually I don't see much changes.
Well,
I think the changes is for my topical or systemic treatment more than the Hollywood building. What do you think about this?
this is true, and I mentioned is my initial treatment. We have different kind of patients. We have patients that say, I want to see result, but the others don't see the result because I don't want to make any comments at my family or any comment at my level. That's why I said they mentioned that the laser branch. I can give a little result session by session, no less than 4 to 6 sessions. I can give glowing, I can erase pigmented lesion because it's a Q-switch laser. You remember that I start, make the explosion of the carbon solution, but after that, you continue apply the Q-switch laser. That's why you can be able to erase any kind of pigmented lesion at the same time. And it's my first step. When the patient have a good condition with me, we have a good relation, I say, well, go to the next step and apply the layer B. As I show you, in some cases I combine it. Redness for 3-4 days and little more, I can make this vacuola inside the dermis. That's why I can get a little more improved. And prepare the patient for the last one, the CO2.
Dr. Perez, I have a question. You have a patient that you have prepared his skin and you use your topical 1 month before and after, but you did all of that and you have PIH, a severe PIH. What do you do with those patients?
First, I don't sleep during a week. It's a mess, it's a headache. Worse than that is when the patient create or get leukoderma, confetti leukoderma is a great mess. I show you during an IMCAS webinar as a problem of mine. There is no solution. It's a big problem. That's why nowadays, I am older, that's why I prefer to go gentle. I prefer to say to the patient, I give you 2-3 sessions for free, only to be sure don't have this paradoxical reaction, because you still have paradoxical reaction with a picosecond or nanosecond. More when a nanosecond, we just still send heat to the skin. With the pico, it's close to nothing, but you still have this problem. That's why if I have this PIH, I put the patient on my back during 6 months, give a lot of free treatment, and apply again the picosecond device gentle, really gentle. In some cases, I have good results.
Great. We had with Cesar some experience in those kind of patients using super potent antioxidants, oral antioxidants as superoxide dismutase, glycodine with great results as well.
Again, which?
Superoxide dismutase.
Okay, I don't experience with that. You're going to tell me in a few minutes.
Okay, thank you, Dr. Perez.
Okay.
Our next